Yeah, it's a great question. So lung cancer screening is a bit different than the other organized screening programs. So breast, cervical, colorectal. For those programs, it's population based, meaning you just age into the program. So in Ontario, when you turn 40, congratulations, you are now eligible for breast screening. Please go get your mammogram. Lung cancer screening is a bit different in that it is risk based, not population based. And so really it's a two-step process. So the first step is you need to be within the age eligibility range. So where I am in Ontario, it's 55 to 80. You need to have significant smoking history. So you smoke cigarettes daily for 20 years, and you need to have no signs of lung cancer. So if you meet those criteria, then you're now eligible for a risk assessment. The risk assessment in Canada and in many jurisdictions in the world, we use the PLCOM 2012 model, which is a clinically validated model to assess risk. So based on the score of that risk assessment, then you are eligible now for, you may be eligible for lung cancer screening. And so the process is quite confusing for many folks, for both the public as well as clinicians. And so the purpose of this tool is to try and simplify the PLCOM 2012 model into a format that's very user-friendly, that alleviates some of the confusion around lung cancer screening. Yeah, so we're quite clear in our messaging that the only official risk assessment result is the risk assessment result that's conducted with the screening program. What this can do is this can be supplemental to that clinician-patient conversation to really help facilitate that informed decision-making process between the clinician and the patient, to help the clinician understand, should I make the referral for screening? Once that referral is made, then the official risk assessment is conducted. But this is just a tool to help the clinician understand, is my patient actually eligible, or may they be eligible for lung cancer screening? The other thing that we're hoping to see with this tool is we hear stories of patients who go to their primary care provider multiple times with a chronic cough, unexplained weight loss, they're coughing up blood. And instead of thinking of lung cancer, the clinician is thinking pneumonia or other respiratory diseases. And this patient often has to go back multiple times. And so we're hoping that this user-friendly tool, like the risk calculator that we developed at the Lung Health Foundation, can also help clinicians think of lung cancer screening when they're seeing a patient with persistent cough. So there's a few purposes of the tool. So one is convenience, the fact that the public can use this when they're taking the bus to work or when they're sitting on their couch. They can use it in a very user-friendly way to help understand potentially their risk of lung cancer. There also is a big element of stigma and shame for many people who think that they may have lung cancer. And this can help with that process of, if they're not ready to have that discussion right off the bat with their primary care provider, they can use the tool and start to think among themselves if potentially lung cancer screening is something that's important for them. It's also really important for clinicians. We recognize how busy primary care providers are. And this is a tool that can help primary care providers in a very streamlined way have that discussion with their patient that lung cancer screening may be right for them. And so it's convenient for the public, but it's also convenient for clinicians who we recognize are quite overworked and quite busy. It's a way to have a more streamlined discussion with the patient. So one of the things that we did when we built out the risk calculator is we created a PDF version that the patient can actually print out. So they can bring that to their primary care provider and really kick off that conversation in a very quick way, recognizing time is of the essence. So all of the answers to their questions are printed out in that PDF that they can then sit down with their primary care provider. It is quite a quick tool. So we also envisioned primary care providers could be sitting down with their patients in their clinic and very quickly answer the 10 questions and understand if a referral is necessary or appropriate. And so it was meant to be very streamlined, recognizing that primary care providers, time is of the essence. Really, all patients can benefit from this. It's really meant to be user-friendly across all patient populations. But it's especially important for patients who may not have a primary care provider. In many lung cancer screening jurisdictions, you can self-refer for a risk assessment. You don't necessarily need that primary care referral. And so for those patients who don't have a primary care provider, this also is a very useful tool for them to help to understand if they may be eligible for screening. Again, the only official risk assessment result is that those that are done by the screening program. But this is a tool for people who may not have primary care providers to help them start thinking of if lung cancer screening is appropriate. Yeah, so the risk tool that we repackaged into a user-friendly version, so the PLCOM 2012, it is meant to ensure that the harms are less than the benefits. And so with any medical intervention, whether it's taking a Tylenol when you have a headache to a surgery, there is there's risk. And so lung cancer screening, low-dose CT scan, which is the modality for lung cancer screening, it also has risk. And so this risk assessment tool is meant to ensure that only those that are highest risk are actually accessing screening. So it's really meant to build out the risk versus benefit ratio.